has been a nephrology social worker for over 40 years. She has worked for and volunteered with NKF and served as national chair of the clinical nephrology social workers. Beth wrote the NKF CKD guideline on functioning and well-being. Beth coordinated Missouri Kidney Program patient education program classes and trained ESRD surveyors. Those are the surveyors who go into a dialysis unit for CMS. Beth consults with the nonprofit Medical Education Institute, where she's a writer, researcher, and outreach expert. Beth speaks and writes on treatment options, paying for treatment, finding and keeping a job, and living your best life with kidney disease. It's my pleasure to introduce Beth Witten, and she's going to talk about staying employed and getting back to work. Welcome, Beth.
Actually, I added to that going to work, because there may be some people that are maybe just getting out of school or haven't worked and are thinking about going to work who have not worked before. So I decided to add that as well. But first of all, I'm going to get my computer to go along with me. I want to disclose that I am, as Lori said, a consultant to the nonprofit Medical Education Institute, and MEI administers multiple websites. The first one that it administered was the Life Options one, and that has a lot of information on chronic kidney disease and just a whole variety of information. More recently, and this has been a long time ago too, it started the Home Dialysis Central website, and there's a Facebook group that is Home Dialysis Central Facebook group. There's Kidney School. I'm going to talk about one of the modules in Kidney School later. They have a decision aid that's called my Kidney Life Plan, that is kind of a cool tool that people can use to find the type of treatment that fits best with what they want out of their life. And then for professionals, there's the KDQOL Complete website that scores the surveys that hopefully you guys are taking, that helps the team know areas where you might need help in physical and mental functioning, or in how dialysis is working for you. So those are the MEI major programs. They do some research and some other things as well. So today we're going to talk about the benefits of working. We're going to talk about the barriers that I'm sure you could tell me more about, that I'm going to share some that I know of with you. And I'm going to talk about the work incentive programs. They're kind of complex, but I'm going to try to make them as simple as I can. And then talk about some other places where you can look for information, some resources to help you get a job or keep a job. So first of all, I don't know how many of you know about the history of dialysis, and I didn't go back into the way back history, but back a few years before I got into kidney disease in 1978, dialysis machines were limited, and there were not many people that were doing dialysis. I believe the first time there was dialysis done was back during World War II. In 1962, the very first dialysis clinic opened up in Seattle at the Seattle Artificial Kidney Center. Later on, it went through some different names like Northwest Kidney Center, and now it's Northwest Kidney Centers, because there are multiple NKC centers around. Back in the day, as you see in this picture, patients were selected for dialysis, and it was based on whether they were perceived to be of value to society. Most of the patients were young males who were employed, insured, and they didn't have other health conditions. They didn't dialyze children. They didn't dialyze people with diabetes or some of the other health problems that people are getting dialysis with. They had a life or death committee at the Seattle Artificial Kidney Center that consisted of those people that I listed. There's a really cool article. You can find it on Google. I think it's in Google Books. That was in Life magazine in 1962 by Shana Alexander. Anybody that's old like me will recognize that name. She did an article and it was called "They Decide Who Lives, Who Dies." I actually bought the magazine a few years ago because I was very curious about what it had to say. And it talked about the people that made those decisions and the patients that got selected for dialysis. I know a couple of patients who went through the selection committee back in the day. One of them just recently died, had been on dialysis since 1966. So when people talk about, when you go on dialysis, you may only have this amount of time to live, that's not necessarily true. It depends on a lot of factors. And I believe that being as active and involved as you can be, trying to overcome depression, all that will contribute to your living a long life. So you saw the history. There was not Medicare until 1973. There was in Congress a patient who dialyzed on the floor of Congress, and Senator Vance Hartke, who was from Indiana, gave this as part of his testimony. He said that 60% of those on dialysis can return to work, but require retraining, and most of the remaining 40% require no retraining whatsoever. These are people who can be active and productive, but only if they have the life-saving treatment they need so badly. And you have to keep in mind that back in 1972, they were still choosing people for dialysis that didn't have other health problems, that were not very old, that were not very young. So that's where they came up with these numbers. And the thing is that we're still working on this promise right now. So how many patients work? There's a data system called the United States Renal Data System that provides data. It's 2 years earlier. So you see here the data that I'm reporting is from December 31st, 2019. And this is looking at patients that they call the working age group of age 18 to 54. And about 25% of the people in 2019 were working full or part-time, and about 1.5% were in school full or part-time. That doesn't count the very young people because we're only looking at people 18 to 54. So work barriers, it's not easy to work when you have a chronic disease. Probably one of the biggest challenges is not knowing how your health is going to be from day to day. Another big challenge is that with kidney disease, a lot of people react to kidney disease with depression or anxiety, people being sad about their situation, which is not unusual, which would kind of be expected, along with being anxious about how their life is going to turn out. When you do dialysis in a clinic, the schedules don't fit very well with work schedules that typically are Monday through Friday, 8 or 9 to 5, and the dialysis clinics are operating during those times. So one of the things that can help people to work is to do home dialysis. And the government right now is trying to encourage more clinics to offer home dialysis to patients. Unfortunately, so far, the incentives that they've offered haven't done a whole lot of good with increasing the number of patients on home dialysis. But the hope is that with more encouragement and with more people getting some of the myths and misinformation that they may have out of the way, we may see more people working. The other thing is that staff don't always know about work resources, and even the social workers. I am on a listserv with other social workers, and I try to share the information that I have as much as I can to encourage them to reach out and learn more about what resources are available to help people get back to work. One of the biggest challenges is that families and friends may be trying to protect people that have kidney disease. You may have felt this yourself, that your family is trying to say, don't do too much, don't work too hard, maybe you should take disability. It would allow you to get your treatment and not be so stressed. The other thing is that employers sometimes are concerned about hiring people with disabilities because they may think these people are going to miss a lot of work. They're going to not be as productive. The people that I know who have worked in spite of kidney failure don't take sick days unless they really absolutely have to. They save their sick days for hospital stays. They're actually very good workers. The other thing is that when you're getting Social Security disability or supplemental security income, SSI, I'll talk about those later, that can be a safety net, but I also see it as a ball and chain because once you get those, there's a fear of losing it. And that can cause people to choose not to try to get more training or education to go back to work. And I'm going to talk a little bit about that later on. But the benefits of working, obviously, if you're working, you're going to have higher income. Most people don't realize that Social Security disability replaces on average about 40% of the income you get from work. If you are a high wage earner, it's going to be less. If you were a low wage earner, it may be a little more, but it's not going to replace your income at 100%. So then you're dealing with people that are anxious because now they don't have the income and they still have the bills. The other thing is being independent, having higher self-esteem. You're doing something that makes you feel good about yourself. You have an opportunity to meet more people and to socialize versus staying home and just thinking about your illness, which contributes to depression. So your mood is better. You often, because you're working, you may have better health insurance, and it may be that the employer is paying a good bit of the cost of that, so it may be cheaper for you. The other thing is that research has shown that people who get transplanted, more of them are working and insured, and because they have the resources, the income, the health insurance, and so forth, their transplant may last longer. So when you have a disability, when you have kidney failure, maybe it's worth looking into self-employment. There are plenty of jobs out there. There are all kinds of people that are advertising for helpers, for people to work, but sometimes you may not feel like you can work on a particular day. You may need a more flexible schedule. That might be something that could contribute to thinking about self-employment. So who would be the most likely person to be self-employed? Somebody who is motivated, doesn't need somebody standing over their shoulder telling them what to do, somebody who can organize their own day. As I mentioned, the flexible hours is really important for people that have kidney disease. Maybe they don't have good transportation, or maybe there's not really good public transportation in the town. So nowadays, gosh, everybody's working from home. And you would need to think about things like, well, how can I get the money to get a business going, or to get something that I could do as self-employment? And then how might work affect your benefits? I'm going to talk about that. And where can you get help to start a business? This website that is called the Job Accommodation Network, and I've given you the link here. If you look under entrepreneurship on that website, it will give you suggestions. So let's talk a little bit about Social Security disability work incentives. I, first of all, have the 2022 numbers on here, and I just found out yesterday they've released the 2023 numbers, so I'm going to tell you about them. So if you want to go back to work, you have 9 trial work months, and any month that you work earn less than $970 doesn't count as a month of trial work. If you earn more than $970 this year, that will use a month of trial work, but you get 9 of them. And it's a rolling trial work period. So say you worked a couple of months now, and then you waited and you went back to work, you'd used up the 970 for a couple of months, you would still maybe be able to get those back if you waited long enough to go back to work. The other thing is earn less than that. That is just extra money on top of your SSDI. The other thing is they look at, when they're looking at after those 9 trial work months, are you earning enough to be considered substantial gainful activity? That's a Social Security term. And if you earn less than $1,350 this year, after the trial work period, that won't stop your benefits. You can see here that I've got the 2023 numbers as well. If you are blind, legally blind, you can earn more money than somebody who is totally sighted. So they have a great lobby. They've been able to get higher limits on some of these things. So the other thing is that if you're earning over the amount of money that is considered substantial gainful activity, you're earning $1,351 or more for 3 months, then your cash benefits could stop. But the good news is, see on the right side, it says easy back on. If you go back to work, you're working, you lose your Social Security disability because you've been working long enough, your income is high, and then you get sick. Guess what? You can get back on without having to file the new application, without having to wait that 5 months that you normally have to wait for your Social Security benefit to start, as long as you got sick within the next 5 years. The other thing that a lot of people don't know about is that if you're paying for things that help you to be able to work out of your pocket, and you show those receipts to Social Security, they will reduce the earned income by whatever you had to pay for those expenses. That's impairment related work expenses. Another thing that's really cool is that once you get a transplant, after a year, Social Security can determine that you are considered recovered. And although you'll keep your Medicare, you may lose your disability. So my advice to people is, while you're on dialysis, before you get that transplant, if you're looking to get a transplant, go through vocational rehab, get the training that you can use to work in the field that you want to work in. Maybe the job you had before was not the type of job that you really want to have. Now's the time that you can get help from Voc Rehab and maybe get the job that you want, even while you're on dialysis or after you get your transplant. Being on dialysis, Medicare continues no matter whether you work or not. When you get a transplant, if you're not 65 or older or have another disability besides kidney failure, then Medicare can end in 3 years. But it can continue longer if you're working under the Ticket to Work program. So I've got a couple of links at the bottom of this page. And by the way, I've sent my slides in a PDF to Lori, so they've got it there to be able to share with you guys if you'd like to look at it. And all these links will actually work. If you click on, if you go down here and click on it, you see the little hand there. That shows that the link will work, so it's hyperlinked. So if you have not worked very much and you've not earned enough income to have enough work credits to get Social Security disability, you may be getting SSI. And SSI has the same impairment related work expense thing where they deduct what you've had to pay to keep yourself healthy enough to work from the earned income. I talked earlier about having the money to be able to start your business. That's when you can set up a plan for achieving self-support. It allows you to set aside money into a special account that you use for starting your business. And that ends up not taking money out of your SSI cash. It's like the government is giving you money to be able to have your work goals. If you work with Voc Rehab, you can keep your SSI cash. You can get SSI and Medicaid again if you lose SSI, and then again, your income drops because you're disabled. Students can earn a fair amount of money during the summer or over the year, and there's the amounts there. But the cool programs, 2 cool programs under SSI that I think are really great are 1619A, where The first $85 that you get of earned or unearned income is basically free. After that, they reduce your SSI cash by $1 for every $2 that you earn, but you can earn a fair amount of money before you lose your SSI cash. And then under 1619B, if you need Medicaid, you can be eligible for that, even if you have a decent amount of income from your job. There's a state threshold amount that I have listed an example in California. You could make up to a little over $54,000 this year, and more if you're blind, from working and still keep Medicaid under 1619B. This is a program that's administered by Social Security. So sometimes the Medicaid office people don't know about this, but Social Security is where you would go if you want to go back to work and earn an income. And there's a website for all that, and I'm going to talk about that later on. There are also tax benefits and credits for people that are disabled. I'm not going to go into all these because I don't want to take too much of your time, but this living and working with disabilities kind of describes them all, and the link at the bottom of this page talks about that. But some of the ones that you might want to know about is that your disability payments may not be included in your gross income. The impairment-related work expenses, again, is a deduction on your taxes. There are medical expense deductions. And I was surprised by this one. If you want to attend a conference on your condition, you could count that expense for the registration or whatever it costs you to go to that conference as a medical deduction. And then there are just various kinds of tax credits and so forth. So there's a variety of things that can help you if you want to work with a disability. And then we worry about employers, and their attitudes about working, whether or not people with disabilities are going to be able to do the job. They have various credits as well, or tax deductions. So small businesses, and that is a business that makes less than $1 million or has 30 or fewer full-time employees, if they have to have interpreters or different kinds of, like ergonomic chairs or special computers or different things that cost money, they get a credit for that. And then any business can deduct up to $15,000 a year to remove various barriers for people with disabilities. And then the work opportunity tax credit helps reimburse employers for a certain amount of the employee's income, what they've paid for the employee. And it depends on the type of employee and how long they work, but it includes people with disabilities. Finally, employer education and advocacy is very important. It's important to ask your doctor or your team for help educating an employer about what your needs are. When I worked in dialysis, I would have patients that were concerned about their job, and I would talk to them, and I would make up a letter and ask them if that looked okay, and then I'd get the doctor to sign it, and that would help them. I had patients that really were afraid they were going to lose their job, and their employers understood that they were protected under the Americans with Disabilities Act as somebody with a disability, and it made it so that they accommodated their needs. If you need job changes, if you need accommodation, ask your employer for that. Again, this job accommodation network that I list at the bottom, this Ask Jan site, has various kinds of accommodations that people with kidney disease might want to ask for. You don't have to tell your employer that you have kidney disease or that you're on dialysis or that you have a transplant. You just have a disability and you need accommodation. So there are laws that protect you. The Equal Employment Opportunity Commission enforces the Rehabilitation Act and the Americans with Disabilities Act. The ADA applies to employers with 15 or more employees. There was a court case several years ago called Fiscus v. Walmart. And Kathy Fiscus was a patient who was on dialysis. She had asked for accommodation from Walmart, and Walmart, I hate to say it, typical to Walmart, refused to allow her accommodation. And then she got a transplant. She was off from work because they wouldn't accommodate her kidney failure. And when she got the transplant, that extended her time off longer than they allow typically under their employment contract, and they fired her. So she got a terrific attorney who really looked at all the different ways that kidney disease affected her life. And the case got pushed up to the circuit court, the third district circuit court, and they found that Walmart had not treated her very well, and they remanded it back to the district court that had found in favor of Walmart. And because they sent it back, then it became a precedent. And if you go look up this case, at the top of the case, it says precedential. And that's not presidential like, President of the United States, but it set a precedent for kidney failure to be protected under the Americans with Disabilities Act. The Department of Labor has Family and Medical Leave Act and COBRA, which is the continuation of your health insurance. The Family and Medical Leave Act can allow you to get used to dialysis, to go to home training, to do a variety of things, take up to 12 weeks off from work if you qualify. You've worked long enough to qualify under FMLA. You work for an employer with 50 or more employees. That will help you. You don't have to take disability. You could take a FMLA that protects your right to promotions, that protects your insurance, all kinds of things. So that might be something to look up. I've got at the bottom of the page where you can look for various things on EEOC, what they have information about for employees, and also employee rights under the Department of Labor. So ESRD networks can help patients and help staff of dialysis clinics. Some of the things that they've done is providing information to clinics to help them evaluate patients to see whether or not they might be good candidates for vocational rehabilitation. Vocational rehabilitation is available in every state. There's also employment networks that are contracted with Social Security that provide rehabilitation, help people find jobs, keep a job. So there's all this information. There's a questionnaire that they've been able to use with patients to determine if they are ready to go back to work, ready to get services from Voc Rehab. It's really important for the clinics to work with vocational rehab agencies to try to help the counselors and the Voc Rehab agencies see that people that are that have kidney failure, that are on dialysis or have a transplant, need those services. They need the help to be able to write a resume, to be able to search for jobs, to be able to find a job that offers them health insurance, that offers them accommodations, and then helping clinics to see the benefit of having patients involved in what they call their quality assessment and performance improvement teams, looking at what are some of the things that could help patients more. Patients and family members have a lot of myths that they believe about what will happen if you go back to work. You may have some of those yourself. As I talked about the SSI and SSDI, you could see that you don't necessarily lose your cash benefits right away. There are programs that will ease you back into work, and you can keep your health insurance. Dialysis patients, if they've got Medicare, can keep their Medicare. If you've got a COBRA plan, you can keep that. And if you work with Voc Rehab or an employment network, or go back to work, those can be great resources for you. Sometimes dialysis clinics back in the day had lobby days with vocational rehab people coming in. During COVID instead, what the networks helped them do is to develop a Voc Rehab bulletin board. I don't know whether any of your clinics have done that, but that could be helpful. Sharing websites about things, places to go, places to look for work at home opportunities. I can tell you there's an employment network that I think has the most disabled people that have given their virtual, what they call ticket to work to them, and it's called AAA Take Charge. They will get paid by Social Security when people go back to work and they stop getting benefits. They get payments from Social Security. Most of the employment networks keep those payments. This AAA Take Charge will pay you if you go back to work, if you've given your ticket to them and you have expenses related to work. It could be that you have to buy uniforms, or you have to pay for transportation to get back and forth to work, or maybe you had to do something to work at home, like you had to buy a computer, or you had to set up a special phone line or something. They can reimburse some of those expenses, and those are not taxable. So that might be something to look at. And they have a lot of work at home jobs. And then there are inspirational stories. I bet some of you have inspirational stories that you could share. Years ago, one of the social workers that I knew who worked in Wichita, Kansas, I'm in Kansas City, she worked with patients, and she got their stories and then got their permission to post a picture of them with their stories in their clinics. And it was a way that people could see that the folks that were coming to dialysis had lives away from dialysis. So those inspirational stories and peer mentoring opportunities can go a long way toward helping people to live full lives and to maybe go back to work. Okay, so you can educate yourself about working. I told you about the kidney school that MEI started. This is one of the 18 modules on kidney school, and it has information about a variety of topics. It has choosing work, not disability, finding work-friendly treatments, keeping your job, addressing symptoms, using FMLA, talking to your employer about your health, asking for accommodations, addressing job discrimination, getting back to work, getting a new job, testing for drugs, finding resources, learning about employer tax credits. So all these things are discussed in this module of kidney school. So you might want to check that out if you get a chance, and I've got the link at the bottom of the page. So there are some employment resources that I've shared here. As I said, there's the Job Accommodation Network that has information on it about kidney disease. The Office of Disability Policy has a variety of information that's on the Department of Labor site. Social Security has a work site at choosework.ssa.gov. And under that site, there's a special place to look to find help, where you can find the employment networks or vocational rehab agencies in your area. There's also agencies called One Stop. So those are a variety of the resources under Social Security. And then the Senior Corps of Retired Executives can help people who want to set up their own business, to start the business. They can help you with developing a workable business plan, and they're a partner with the Small Business Association, and they may be able to help people find loans. So that's a good resource. And then if you contact the patient services person at your ESRD network, and I give the link here for the network map. When you go to that map, I had that on a previous slide, you just click on the state that you're in, and it will tell you where the network is, what their contact information is. And actually, dialysis clinics should have a poster posted in the common area in the waiting room, where it has contacts for the ESRD network in your area. So the patient services people are the ones that know the most about working and addressing work challenges. Then support is so important. So support is so important when you've got a health condition. It's nice to get support from people who understand what you're going through. So here are some of the places that, and there's plenty more. These are just a few. The American Association of Kidney Patients has information about support. As I said earlier, Home Dialysis Central has a Facebook group. It has about, I think, around 7,000 or so patients on that. They're typically people that are on either PD or home hemodialysis, although there are some patients that have gotten transplants that are still on there. And there are family members, support people, people that are helping to do the dialysis for their loved one. There are some professionals on there as well. I'm one of the administrators there, and I make sure that I try to share information as I find it out. There's also a forum that is that Home Dialysis Central set up, where people can message and go back and look at old messages and how people have responded to them. NKF has peers, which is a peer support. You can contact them and get someone similar to you to talk with. And obviously the Renal Support Network that we're doing this through is a great resource for peer support and has all kinds of resources, like podcasts and newsletter and just terrific resources. And then dialysis corporations may have their own support groups and listservs. So if you don't have a support group at your clinic, you might talk to the social worker and say you'd be willing to help get one going. I think that they often work best when they are educational support, because people often don't want to admit that they need support, even when they do. So, back in my day, I actually had a support group for spouses of dialysis patients, because often they didn't get recognized for all that they did, and I wanted them to have somebody to talk to. So, support groups are really important. Listservs are great ways to keep in touch with folks. So that's another way to get your questions answered. So I'm going to wrap up here and say you can work using legal protections, work incentives, your team's help, and support from family and friends. If anybody has any questions, I would love to hear them. So I'm going to look in the chat, because I wasn't looking at that while I was talking, and see what's in there. Talking to supervisors, coworkers that already know your condition and want to ask about your health. I have known patients who have been very open about that, and I have known patients that nobody knows at their workplace that they're dialysis patients. I think sometimes it's hard to know how much to divulge. You don't want, I've heard from people, they don't want sympathy. They don't want people to feel sorry for them. And they don't want to necessarily be treated any differently. But if they do ask for accommodations, they don't want their co-workers to think, oh, they're getting special treatment. So to some extent, it's up to you, whatever you feel comfortable with. And so far as legal issues, a workplace is not a place that is under the HIPAA. That's all healthcare stuff. So, whatever you're willing to talk about, you're open to talking about. Don't feel like you have to. Let's see. Oh, yeah. And your own state may have its own disability laws besides the federal ones. So there's often a disability commission in each state. And so there may be, as this person says, more liberal rules, state rules than federal. Let's see. Okay. Anything else? Let me see. People who attend the RSN support group share their experiences, strengths, and strategies to live hopeful and joyful life. And it's the fourth Sunday, the second Tuesday of every month from 2 to 3:30 p.m. Pacific time. So that's good news, good information to have as well. Yes.
But there is a question in the Q&A that I'd like to read to you.
Okay.
It says, it's from an anonymous attendee. I have a transplant and started working at my regular hours at work. I was advised to pay back the SSI that I received. Is that usually the protocol for SSI if a patient is able to work their regular hours and receive their regular salary?
You don't have to pay it back. You need to report. If you're working, you need to report to Social Security that you're working. And then, and I would definitely keep a notebook. Like you may have a notebook for questions that you want to ask people. Keep a notebook when you talk to anybody from Social Security or any federal agency. When did you talk to them? Who did you talk to? What did you ask and what did they say? Because there are times when I knew a patient once who had reported to Social Security that she was working, and somehow or another, it didn't get into the system. And then she was told that she had to pay back money. And if she had, and she didn't, if she had on October the 21st, I talked to Mary Smith at Social Security and told Mary that I was working. I provided documentation of my payroll stubs, and she told me she would enter it in the system. Now, the other thing is if you continue to get your checks after you've earned enough to where you shouldn't be, I would definitely let them know that, and I would put those in a separate account, put it in a savings account, make what little bit of interest you can make on it right now, so that if they come back and want the money back, that you can pay it back because you've saved it. Did I answer that, do you think?
I think so.
There's another question in the chat. Is a person protected when they can't work full-time due to their health, but employer refuses to allow them a part-time situation?
They're supposed to, I would bring up to the employer that I am protected under the Americans with Disabilities Act. Do you have another job that you can put me in where maybe I could work part-time at work and maybe I could do some of my work hours at home? It might be that the company doesn't have any part-time positions. And in that case, I'm not sure that they're going to make a part-time position for somebody, but maybe part of the time you could work at home and part of the time you could work on the job. I had patients in my clinic that, brought their computer to the clinic and they did work while they were on dialysis. So, that's a possibility as well. And with so many people doing telework now, it may be even more possible than what it was back in my day when I was working at the clinic. Anybody have any other questions?
I think this might just be a statement, but it says kidney patient fall under the ADA for work protection and accommodations. I
Yeah,
think
and that's what I was saying, that that case, that Fiscus v. Walmart case, that
Right.
was the precedent. You know, and the interesting thing is that I don't know whether at this point, I haven't looked lately, but at some point diabetes was not protected. So I was thrilled to see the case. I read the case that was in the Third Circuit Court of Appeals, and the way that the attorney described dialysis as the impact on somebody's life, because you're supposed to, under the ADA, have enough of an impact to your life. It seems like people would think, well, okay, so maybe you can't pee as much. What's the big deal about that? No, it's like it changes your diet, it changes your fluids, it changes, it changes your energy level, all the things that kidney disease can do, which could mean that you do need accommodation. You may need an extra break. You may need to be able to sit on your job instead of stand all day. You may need to work remotely part of the time. So those are the kinds of accommodations that you might need.
right. And allowances for multiple medical appointments, certainly more
Exactly.
than your average person, right?
Exactly. And like say you need to go to dialysis, and your dialysis schedule, maybe you have to be there at 3:00 in the afternoon, and you normally would work till 5. Well, FMLA, could give you that time, but unfortunately, FMLA right at this point is not paid. So maybe you could work longer on the days that you don't have in-center dialysis to make up for the couple of hours that you're going to miss on the other days. Or maybe you can arrange your dialysis schedule, instead of it being Monday, Wednesday, Friday, to be Tuesday, Thursday, Saturday. And that's where a dialysis clinic can help as well, to let the clinic know what you need to be able to work. And when you're talking to the doctor, there may be forms that the doctor will need to fill out for an employer, and make sure, if you want to work, that you let the doctor know, fill this out in such a way that it appears that I can work. I'm not asking to stop working. I'm asking to be able to continue to work.
Okay, great. Thank you, Beth. We have one more question, and then we will move on to our stretching with Adina. But the next question is, I have not been able to reach someone at my local SSDI office for months. And do you have any suggestions on what to do?
Oh my gosh. So one of the problems with Social Security, one of the problems with COVID, it's not even with Social Security, is that for a long time with COVID, all the Social Security workers were working at home. They were working remotely too. So they've got a lot of backlog of disability applications and all kinds of things. I don't know whether when you try calling the Social Security office, whether you're leaving a message and nobody's calling you back. You could call the main Social Security 800 number, 772-1213, and say that you're having trouble getting through to the Social Security office. Can they put you through to the supervisor, the field, whatever they call I can't remember what they call the head of the field office, but whoever's in charge of the field office, so that you can get a response.
Okay, good. And we'll slip in one more. It's a follow-up for the repayment for SSI.
Yeah,
Contact.
I've
or
never
repayment.
heard of, unless somebody has worked getting SSI, hasn't reported to Social Security that they're working, that might be the time that they would ask for money back. But typically, if you've reported and they've stopped your check, they wouldn't ask for money back. I mean, you were due that money. But somebody also posted in here to contact your federal legislators and ask for help with SSDI. Let me tell you, the elected officials for federal programs, what happens is you write a letter or you call their office and it goes into congressional inquiry, and federal agencies have to prioritize those questions, those problems. So they're great resources, either your senators or your representative.
Super. Thank you, Beth. And thank you for a wonderful presentation today and all your expertise. I know, we are recording all of these presentations during Hope Week, and I know I'm going to be referring a lot of people to your presentation. These are concerns and questions that we hear all the time. And so
I want
very
people to feel like they don't have strikes against them. There are challenges. There are definitely challenges, and I'm not saying it's easy, but there are people that can help you too. And people that are working, that have gone through it before, people that are hopefully your social worker is knowledgeable. So
okay. Super. Well, thank you, Beth,
for inviting me to do this. I really appreciate it.
It was our pleasure, really. Thank you so much.
And a shout out to our corporate mission partners for making this happen.